Hello, friends. Today we are going to discuss you can treat rheumatoid arthritis naturally. Donna McKenney says that the two most painful things in my life are arthritis and divorce. How painful she feels her arthritis. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM, and I am a medical nutritional specialist. Let's discuss what is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells of your body by mistake, causing inflammation in the affected parts of the body, joints. Rheumatoid arthritis mainly attacks the small joints of fingers, usually many joints at once, bilaterally. Rheumatoid arthritis commonly affects joints in the hands, wrists, and knees. In a joint with rheumatoid arthritis, the lining of the joint becomes inflamed, causing damage to joint tissue. Tissue damage can cause long-lasting or chronic pain, unsteadiness, and deformity. Rheumatoid arthritis can also affect other tissues throughout the body and cause problems in organs such as lungs, heart, and eyes. This is a picture of rheumatoid arthritis patients, and this is the swelling and inflammation, and this is the blue one is the lining of the synovial membrane, which has been inflamed and giving the swelling of the joint. What causes rheumatoid arthritis? As I told you, this is an autoimmune disease. Normally, your immune system helps protect your body from infection and disease. In rheumatoid arthritis, your immune system attacks your healthy tissue in your joints, especially the synovial membrane. It can also cause medical problems with your heart, lungs, nerves, eyes, and skin. What are the three types of rheumatoid arthritis? Types of rheumatoid arthritis are seropositive or seronegative rheumatoid arthritis. Rheumatoid factor positive are called seropositive rheumatoid arthritis, and rheumatoid factor negative are called seronegative rheumatoid arthritis. And there may be overlapping conditions with positive as well as negative. The presence of anticyclic citrullinated peptides, we call it anti-CCPs or anti-citrullinated protein antibodies in the body, along with physical symptoms of rheumatoid arthritis in the patient, confirm the diagnosis of rheumatoid arthritis. They are found in approximately 60 to 80% of people diagnosed with rheumatoid arthritis, and the presence of these antibodies may be an early indicator of the start of rheumatoid arthritis. What are the risk factors for rheumatoid arthritis? Factors that may increase your risk of rheumatoid arthritis include your sex. Women are more likely than men to develop rheumatoid arthritis. It is more common in women. Age. Rheumatoid arthritis can occur at any age, but it most commonly begins in the middle age. Family history. If a member of your family has rheumatoid arthritis, an increased risk of the disease is there. Smoking. Cigarette smoking increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. Excess weight, obesity. People who are overweight appear to be at a somewhat higher risk of developing rheumatoid arthritis. What are the risk factors more? History of live births. Women who have never given birth may be at greater risk of developing rheumatoid arthritis. Early life exposures. Some early life exposures may increase your risk of developing rheumatoid arthritis in adulthood. For example, one study found that children whose mothers smoked and double the risk of developing rheumatoid arthritis as adults. Children of lower income parents are at increased risk of developing rheumatoid arthritis as adults. Breastfeeding, on the other side, women who have breastfed their infants have a decreased risk of developing rheumatoid arthritis. What are the 4 stages of rheumatoid arthritis? Stage 1. In early stage rheumatoid arthritis, the tissue around your joints is inflamed. You may have some pain and stiffness. If your medical provider ordered X-rays, they wouldn't see destructive changes in your bones at this very stage. Stage 2, the inflammation has begun to damage the cartilage in your joints. You might notice stiffness and a decreased range of motion. Along with the inflammation of your synovial membrane, your cartilage is also affected in this stage. Stage 3, the inflammation is so severe that it damages your bones as well now. You will have more pain, stiffness, and even less range of motion than in stage 2. And you may start to see physical changes. Sorry. Stage 4. In this stage, the inflammation stops, but your joints keep getting worse. You will have severe pain, swelling, stiffness, and loss of mobility. These are the late stage of rheumatoid arthritis. And this is the cut section. This is late stage of deformity of your hand. And this blue one is the synovial membrane. And this white one is cartilage. And first, this synovial membrane is inflamed, then in this cartilage, and third stage, this bone is also involved. And in the 4th stage, inflammation stops, but the deformity goes on. What are the signs and symptoms of rheumatoid arthritis? With rheumatoid arthritis, there are times when symptoms get worse, known as flares, and times when symptoms get better, known as remissions. Signs and symptoms of rheumatoid arthritis include pain or aching in more than one joint, stiffness in more than one joint, symmetrically both sides, tenderness and swelling in more than one joint, the same symptoms on both sides of the body, such as in both hands or both knees, weight loss may be there, fever, fatigue or tiredness, and weakness. These are the few signs and symptoms. Other organs affected by rheumatoid arthritis. About 40% of the people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Areas that may be affected include skin, eyes, lungs, heart, kidney, salivary glands, nerve tissue, bone marrow, blood vessels. Rheumatoid arthritis signs and symptoms may vary in severity and may even come and go in flare and remissions. Periods of increased disease activity called flares alternate with periods of relative remissions. When the swelling and pain fade or disappear over time, rheumatoid arthritis can cause joints deform and shift out of place, just like a photograph I show. What is the difference between this rheumatoid arthritis and osteoarthritis? Age at which the condition starts. It may begin any time in life in rheumatoid arthritis, whereas the osteoarthritis begins usually in the later life. Speed of onset. Rheumatoid arthritis relatively rapid over weeks to months. In osteoarthritis, it is slow over years. Joint symptoms. Joints are painful, swollen, and stiff in rheumatoid arthritis. Joints ache and may be tender, but have little or no swelling in the osteoarthritis. Presence of symptoms affecting the whole body, systemic symptoms. Frequent and fatigue and a general feeling of being ill are present in rheumatoid arthritis, but in osteoarthritis, whole body symptoms are not present. It is local. Sides of the body symmetrical, such as both hands, both wrists, or elbows, or the balls of both feet. These are in rheumatoid arthritis. Spread to the other side, symptoms begin gradually, are often limited. Usually the joints, usually the finger joints closest to the fingernails or the thumbs, large weight-bearing joints, hips, knees, or the spine. These are mainly affected in osteoarthritis. Duration of morning stiffness is present in, usually lasts longer than 1 hour in rheumatoid arthritis, and morning stiffness usually lasts less than 1 hour, and stiffness returns at the end of the day or after periods of activity in osteoarthritis. Presence of symptoms affecting the whole body, systemic. Frequent fatigue and a general feeling of being ill are present. Whole body symptoms are not present in osteoarthritis. Rheumatoid arthritis to diagnose is diagnosed by reviewing the symptoms of the disease patients. Conducting a physical examination, we can come to know whether it is bilateral, small joints and stiffness, morning stiffness. All these signs and symptoms of rheumatoid arthritis, we can come to know that whether it is rheumatoid arthritis or some other arthritis. Doing X-rays and ultrasound, MRIs will clinch the diagnosis. Lab test, rheumatoid factor, CCP test, CBC, ESR, all these lab tests are done. It's best to diagnose rheumatoid arthritis early in life, within 6 months of the onset of symptoms, so that the later problems of joint destruction are avoided. People with the disease can begin treatment to slow or stop disease progression, for example, damage to the joints. Diagnosis and effective Treatments, particularly treatments to suppress or control inflammation, can help reduce the damaging effect of rheumatoid arthritis. What is the most common cause of death with rheumatoid arthritis? Compared with people without the disease, people with rheumatoid arthritis are almost twice as likely to die before the age of 75 and more likely to succumb to cardiovascular disease and respiratory problem. This was found in a study. Common drugs used for rheumatoid arthritis. The DMARDs that may be used include methotrexate, leflunomide, hydroxychloroquine, sulfasalazine, along with different painkillers. Natural treatments we should know. Exercises and physical therapy. One of the main proven treatments to reverse rheumatoid arthritis is exercises and physical therapy, especially stretching. Probiotics to reverse rheumatoid arthritis. As with most ailments, your diet is very important. Other supplements and magnesium oil, vitamins B6, B12, C, D, and omega-3. Turmeric and ginger are the other anti-inflammatories we can use. Anti-inflammatory diet we can use. Stress relief, yoga, tai chi, meditation, massage, biofeedback, acupuncture. All these are very, very helpful. CBT, psychotherapy, mindfulness, Indian frankincense, Boswellia serrata, Google. It's called Google. Probiotics, LDN, low dose naltrexone, and elimination diet. All these are natural therapies and are helpful in relieving our rheumatoid arthritis. 5R approach to the cause of RA. This I have already discussed with you in our autoimmune disease. We should give a comprehensive protocol to the patient where the 5 R's are adopted. First R is remove. Remove all toxic products, including gluten, milk and its products, caffeine, sugar, infections, processed food like chemicals, refined oils, and others. EMFs, medications, SIBO, small intestine bacterial overgrowth, stress. All these things should be removed from the body with some medications or some procedures. Restore the health, whatever is lacking, antioxidants and nutrients, bile and stomach acid. All these should be restored which have been destroyed. Repair toxic and trigger foods, interfere, nutrients needed, grounding. All these are for the repair purposes. Next is re-inoculate. Prebiotics, and prebiotics include garlic, asparagus, onions, leafy greens, whole grains, quinoa, oats, apples, flaxseed, lentils, jicama, and chicory root. Partially hydrolyzed guar gum is a great option for a supplemental prebiotic fiber. And probiotics, kombucha, pickles, yogurt, kefir, sauerkraut, kimchi, tempeh, and miso. All these prebiotics and probiotics are to re-inoculate the damaged microbiome, relax Mind-body connection is very, very important. Biofeedback, meditation, movements, fun activities, and vacation time, breathing techniques, sunshine, and hydration. All these are very, very important. Prebiotics, which are asparagus, banana, dandelion greens, eggplant, endive, garlic, honey, Jerusalem, artichokes, jicama, kaffir, leeks, legumes, onions, peas, radishes, whole grains, yogurt. And probiotics, acidophilus milk, buttermilk, cheese, aged, cottage cheese, fermented meats and vegetables, cafe, kimchi, kombucha, miso, natto, picked vegetable, raw, sauerkraut, sour cream, tempeh, yogurt, plain, active cultures. All these are important for prebiotics and probiotics. Thank you very much. This is all about this rheumatoid arthritis. Thank you very much.